You know, most people who feel like I have a job, I have health insurance, they don't feel affected by this.
Yeah.
But once they lose their job, they then become interested in what's happening.
Right.
You know, you may have COBRA cover you for a certain measure of time, but then you have to make decisions on what if I can't get a job with the amount of coverage. Like example, I was working for a law firm, and I was paying probably for my entire family like a $300-something premium. I went to another law firm making more money. And what I come to realize is that I end up paying like $150 more a month for my health insurance. And I'm thinking, what in the world is going on? Well, come to find out, this law firm was not as big, probably 100 more attorneys than the previous law firm, so had to deal with size. Secondarily, there were more people sick or had been sick at this new law firm where I moved to, even though I was making more money. And so that affected my premium. So it's amazing with all the different adjustments that can happen when you move from one job to another. So I think our attitude, we have to be careful. We should not have the attitude, just because I have a job, I have health insurance, this doesn't pertain to us, so therefore I'm not interested in it. I think that's a dangerous attitude.
Yeah.
So what is your second question I heard you have, unless you want to ask something else to this debate?
No, the second question that was really burning in my heart, and this is one that I also got some earlier insights from Dr. Levis on, is when you're sitting as a common man, just common American citizen, and you begin hearing terminology like government run, government takeover, it automatically kind of sets a stigma. But then Dr. Levis began to explain the number of government-run insurance companies, organizations, I guess we could call them, that are already in existence. And I only knew of a couple of them. But he began to show me that there are several, or that there are many insurance companies already run by the government. And I was wondering if you could share with just common American people what those are and who they cover.
So again, everyone over 65 is in Medicare, right?
Yeah.
So that's everybody over 60. If you are blessed to live to be 65 years old, you will have government financed health care. 65, that's your reward, right? Well, one of your rewards. Among people under 65, about 28% of people under age 65 are in government programs currently, right now, before any change, before any reform. They either are with the Veterans Administration, because they're military vet. They are in the active duty military system, TRICARE or CHAMPUS. So military is a government program. Or they're in Medicaid, which is the program for the poor, low-income people. So these are all government programs. And altogether, they comprise roughly 28% of Americans under age 65. And of course, all Americans over age 65. So to say that, you know, we don't want government in healthcare, government is in healthcare. Government regulates, even the private companies are regulated, and hospitals are regulated by the government. So it's simply a fallacy to say we don't want government in healthcare when government already is in healthcare. And our government actually, I think, does a lot of good for healthcare by providing those regulations, because, you know, because the private sector is such that you're in business to make money, and you make money by either increasing your revenue, or you decrease your costs, or you control your costs. And there's going to always be a tension. And I'm not saying that insurance companies are evil or anything like that, or hospitals are evil, because I know a lot of people personally and good friends that work in these industries, and I know that they're not evil people intent on hurting people. But the nature of the business model is such that you have an incentive to, you know, you don't want to overtreat, you don't want to overpay, you don't want to pay out more in healthcare expenses than you have to, because that eats into your profit.
Right.
So the private sector is regulated by the federal government, which helps to control that and helps to ensure that people in the private sector getting care does receive good quality care. Well, at least does receive, for the most part, receive the care that they need.
Right. Well, that's why this conversation is so important, because I realize when people do not have a firm understanding of a subject, they're fearful. And then fear basically expresses itself in many different forms, you know. And I think that once you become to understand something with a knowledge where you can make an intelligent decision, you know, it does evaporate some of the fear or the insecurity that's present in a person's heart. So that's why I think that these type of subjects are pertinent in order for us to, you know, make firm decisions and have an understanding of what we're supporting and what we're not supporting, and not be so quick to run down to the, you know, the White House and raise a flag, you know, that we don't want you ruling our lives, and not understanding what are we saying, you know, what you don't realize that government already has a part in the health industry. Yes, Ken.
Yeah, before I really began doing a lot of reading for myself, there was a major red flag that went up, and I had written to Dr. Levis about this one question, because I figured, hey, there has to be thousands of other Americans that feel like this. But when we were watching the Cash for Clunkers program here in America, one of the things that we noticed is that there were a lot of car dealers that were beginning to say that they were pulling out of the program because the government was not giving them their money, their finances in a timely manner. And during that time, again, before I read, a red flag went up, and I said, well, do we really want the government managing our health care, managing our medicine or medical decisions, if they could not deliver what they were supposed to deliver on the clunkers?
Right.
That I really didn't want them handling the medicine at that time. Again, that was before I did a lot of reading on my own. But I would that you would speak to that issue again with the insightful comments that you made to me on that.
Yeah, I mean, so what I would say about that is that I don't think that that's a, I mean, I know a lot of people were making that analogy between if they can't handle cash for clunkers, how can we trust them with health care?
Right.
But you know, I know it's a cliche to say that the government can't do anything,
Right.
and that's become very popular to say that. But you know, my personal experience, I've had a lot of being in the healthcare industry, a lot of experience dealing with people in government, and I have, by and large, found them to be very capable, very dedicated people. And you know, I don't know about you, but my mail tends to show up every day in my mailbox. And if I write a letter and I slap it, what is the stamp now? 46 cents or 45 cents? I write a letter, I slap a stamp on it, or I got to pay a bill. I slap a stamp on it, I put it in my mailbox. A government employee will come to my house, pick up that letter, take it to the other side of the country, and see that my bill is paid for 46 cents. Now, I haven't quite seen FedEx do that. I mean, FedEx can't do that for 46 cents, you know.
Right, right.
So I think the government is much more capable. We have a very effective and a very efficient military. We have, I mean, there are many aspects of government that have been very effective. I mean, you and I were educated at a public university,
Yes.
right, where we met.
Well, Dr. Levis, if you can stop right there, because we're out of time. But we're going to pick right back up from this conversation. That's okay. We're going to pick right back up from this question that Kenneth asked, because I think it's a very, very important question. And this is just the beginning of the layer, because I do believe also as a leader in my church that the church has a great responsibility in all of this. And that's something that hopefully, Kenneth, you and I can talk about a little bit more deeper too. So thank you for watching the Apostolic Forum. We're going to continue our discussion. This is part 1 of healthcare reform. We're going to continue with part 2 in our next broadcast.